recently completed my diploma of nursing, so I am enrolled nurse. In my batch, same class, a lot of students paid 30,000 for the same course. Meanwhile, me and most of my fellow mates, we paid 24,000. Aged care has personal care assistants which look after all the residents, like cleaning, showering, helping them with food, helping them to change. It is a myth that nurses are only girls, like they call sisters as well.
Yes.
But as per the agents, they prefer us to move in the regional areas.
Hi guys, hello and welcome back to another video. This is KapsLock with Kashish Arora. Thank you Kashish, thank you for coming in the video. And today we are in RMIT city campus. But actually we are not going to talk on particular course. It's more of a podcast, it's more of an information related to something which is quite unusual and it's pretty hard to find in YouTube if you go for finding this information, which is related to nursing. Okay, so people think it's pretty easy, people think it's pretty cheap, people think it's pretty easy to do the course and easy to get the PR. But a person who's doing this course or is in the field will be the best person to talk on the topic, discussing the several aspects of what is what and what's the current scenario in Australia if you're thinking of joining this particular course. So over to you, Kashish. First, you can just introduce yourself and then we'll head on.
Hi everyone, I'm Kashish Arora. I have recently completed my diploma of nursing, so I am enrolled nurse. So to begin with, there are two different courses. One is Diploma of Nursing and another one is Bachelors of Nursing. So people normally get it mixed up, or it's only Bachelors of Nursing which is preferred, as RN or registered nurse is more highlighted. But there are also enrolled nurses which are not introduced much, but they do as much jobs as RN. So basically Diploma of Nursing is mainly about enrolled nurse or enrolled endorsed nurses, which are mainly allowed to do or practice with medicine. So which is so begin with duration. Technically Diploma of Nursing is supposed to be 2 years of course, but from college I did was a fast-paced college, so I finished in 1.5 years. With only difference is that we don't get mid-sem break, so we do get enough time in between, a month. Which is because we have placements and different groups get allocated in different durations. So when they are on placements, we get a month off. But there is no official mid-sem break. But
hardly some time that you can sit in. So
yeah, so we do have 1 month. There are, I think, 7 to 8 groups.
Yep.
They go in different times. It's 3 weeks placements after every semester. So everyone can't go in the same duration or at the same time. But there are different places. They go at different hospitals and aged cares. So you get time on and off eventually. But with bachelors, it's a 3 years course, a complete degree, and you do get proper mid-sem breaks. Same with placements, you get placements. For some unis, they allocate you for I think a month after every semester, but some they allocate you after a completion of 1 year. So it depends on which uni you go for. But that's the major difference, the duration of time, so 2 years and 3 years.
with the bachelors of nursing, you said that's 3 years. So there's only colleges or there's particular universities that are allocated to this post?
As per what I know, no college has yet been accredited for bachelors. So it's
For
only
teaching bachelors? Okay.
Yes, bachelors of nursing. So only universities.
I believe RMIT University also does have this course.
Pretty much universities, Victoria University, Deakin University, RMIT University. These are the most common ones and the reputed ones.
In Melbourne only?
Yeah, La Trobe as well, even Federation, but they are not considered as good when it comes to allocation of placements. They'll either allocate you way too far, like in the regional area, far away from Melbourne, or either, I think, yeah, they do trouble you with placements a lot, but education-wise, it's pretty much the same. There is not much theoretical part, just the basics of everything. It's more the practical stuff which you get practices for, and then what you perform in placements.
And with the thing that you did Diploma of Nursing, right? Where did you do it from?
I did it from IHNA, which is Institute of Health and Nursing Australia. So they do have 2 campuses in city. One is in main city and CBD campus, and the other one is, I think, Heidelberg.
Heidelberg, okay.
But they do have in Sydney, Perth, and I don't remember, not yet in Adelaide, but definitely in Perth and Sydney. So they are going very well there as well.
And the placement things, so Did they place you or you found your...
No, they do give us option. They do ask for suburbs. So if you live near city, they'll give you something nearby like Coburg. I got allocated in Coburg when I used to live in St. Kilda. So when I started, they give options in north as well. So if you live in, I think somebody from Craigieburn got allocated in north. I don't remember the name. TLC something. It is an aged care in north side. So they give you options.
It's up to you if you
Yeah.
want to go with them or you want to find by
They
yourself.
try to allocate you as per our own preferences, but if not, they'll just allocate you anywhere. So you'll have to manage. For the first two placements, it's pretty much easy.
Yep.
I'd say it's still 30 to 40 minutes drive, so which is not that bad.
Depends on the location.
Yeah, depends on the location, but it's still nearby because that's why they asked for your suburb.
Oh,
They won't give you, then public transport, it takes 1.5 hours. So it's still not that bad. All the places I have been allocated at were about 1 hour, 30 minutes on train or 45 minutes drive. So
okay. With that said, so this was like an overview of the courses which is present in Australia. In nursing, what's the around fees that you paid or what's the affordability of the...
okay, that's a big thing
Issue.
to look on because I'll say bachelor's is definitely expensive, but in comparison to diploma, for diploma as well, I think you should be very careful about your agent. Don't just straight away go and take admission from anyone, just get consultation and you took admission. No, because in my batch, same class, a lot of students paid 30,000 for the same course. Meanwhile, me and most of my fellow mates, we paid 24,000. So it depends on agent, which agent you choose, and they get you enrolled in. So do ask a lot of agents, do your proper inquiry, and then have a good comparison, then get enrolled.
Okay.
Because that is a big difference. $6,000 for nothing. For the same course, same start time, same finish, everything was same, but
And
they
they're
paid
charged.
30,000.
Damn. With that said, also, what's that's personally what I want to know. What's nursing? What do you have to do? Like as a nurse, do you have to like put injections or stuff?
So it's a lot of things. Beginning with, so it goes semester wise. First semester is just basics, not much detail about all the injections and medicine things. It's just basic body functioning, and that's why the first placements you get is at aged cares. But I don't think colleges and aged care people are much nice to us. They are just a bit too biased. They get us to do PCA jobs, whereas we are supposed to work with ENs or RNs, which is personal care assistant.
Okay.
So every aged care has personal care assistants, which look after all the residents, like cleaning, showering, helping them with food, helping them to change. So that's what PCA does mainly. Or just fixing their room and everything. So they pair us with PCAs.
As an intern.
As an
Kind of.
interns. Yeah, as an interns. But meanwhile, we are supposed to work with RNs or ENs to learn the paperwork, which are nurses supposed to do. So in aged cares, it's divided. PCAs do the ADLs, which is assistance with daily life activities, and nurses do medications and injections.
Mm-hmm.
They have their separate trolley and a list of digital tab thing in aged cares, so which has time, details, medicine, everything about that particular resident.
Okay.
So nurses do that, but in the following semesters we get allocated in rehab, subacute or acute hospital settings. So where we do all the things like helping them in the showering and doing all the medicines, but it goes step by step. In semester 2, I think we were only supposed to learn about medicines like oral medicines, tablets and other things. Only a few basic injections, which is subcut, just the basic ones. But in the third final semester, which is supposed to be acute or subacute, we get to do injections, IVs, IMs, pretty much everything, catheters, IDC. So the basic difference is PCAs in aged cares, they just look after their personal hygiene, personal things. But nurses look after everything who work in hospitals. But if they work in aged care, they just do the medicine.
Whoa.
So yeah, that's
too much to I would say learn or do, right?
That's a lot to learn. It's not just basic one category that nurse has to look after, but yeah.
That's my personal question. Okay, nurses, are they supposed to be girls only or boys do enroll in that course?
It is a myth that nurses are only girls, like they call sisters as well,
Yes.
but a lot of men have broken this myth. And it's good to have male nurses because they are physically more strong. Sometimes we have to transfer them from bed to the wheelchair or back, vice versa. So it is easier to have some men around, and especially with some male patients, they get uncomfortable with us or we get uncomfortable with them. So it is a big help for them and all the female nurses to help each other. Can you help me with this male patient? And yeah, we just switch. So, and they have different perspective of everything of dealing with. So yeah, it is good to have both of them, to be very honest, and less of gossip, to be honest.
And they do give placements to both of them. It's not like bias.
Nothing is biased. Same studies, same placements, everything is exactly same for both of them.
Okay. In addition to that, let's come on the basic stuff. The more importance of what people are watching this video for, permanent residency. Talk on this, whatever you know, whatever you have heard, whatever your experience is.
I'll say it's easy to get permanent residency with RN, which is Bachelor's of Nursing, being a registered nurse. So you get it straight away within a few months. But with ENs, you may have to struggle a bit because some diplomas are 2 years, as I've mentioned earlier, but mine was 1.5 years, which was fast paced. So you don't meet the requirements because it's just 1.5 years of study. Even for TR, you have to study for minimum of 2 years. So it is still a bit of a mess. You can still apply for PR. You need to meet certain criteria. You can get 8 in PT or IELTS, or you can do NATI. Just get up to the points level, minimum points level required, which can, if it's your age is less than 25, you still lose 5 points, but you can do NATI. So you can even it out. Okay. It's just up to you how you figure it out. We're still getting a lot of invites for ENs, which is on the basis of Diploma of Nursing, but as per the agents, they prefer us to move into regional areas because it's easy for us to get jobs. And if we have job, it adds up to our skill assessment, our work experiences, and it just outshines our whole
PR perspective.
Yes, PR and whole of the file that, okay, this person is fully qualified, is fully involved in this, and yeah, it just makes it better. It's not that you won't get PR if you live in city, but it's just if you step out of your comfort zone.
Example, like Sydney, Brisbane, and Melbourne. If you leave these zones, then it will be easy for you to grab PR.
Even in Melbourne, there are outer suburbs which are like
Wollert and
Wollert, and if on the, I think, west side it's Warrnambool or something.
Seems like
there are some outer, but the thing is, getting job there is very hard because people have been living there for so long. And they have been doing this job, especially in healthcare. You'll see a lot of nurses and healthcare workers. They have been doing the same jobs for 10 years. Minimum of 10, can go up to 15. So which is a big thing, doing the same job for 15 years. So it is hard to get a job, but once you get it, it's all sorted for you.
Okay. Well, it's not a question, it's just a basic stuff. What's your personal experience till now in Australia about course, about Australia, about this shit weather, about anything?
Okay, weather is a worst thing of all. It's so unpredictable. But except for that, it has been a good experience. I'm almost about to complete 2 years in 2 weeks. So yeah.
Congratulations.
So I'm glad I made it here. But it was a good experience. Nursing sometimes may feel like pain in the ass, to be very honest, because of the placements are very hectic. First 2 placements were 3 weeks and the last one was 4 weeks. You don't get paid for any of it at all. And some facilities are very stubborn about something, so they exclude your break. You know what I mean? So if it's 8 hours a day, they'll ask you to stay 8 hours and 30 minutes if you have taken a 30 minutes break. So which is unfair. And nurses rely a lot on us. They don't do their jobs. They'll just depend on us that, okay, you do this, you do that. So they chillax, which is not fair on us. But throughout, it has been a good experience. There's a lot to learn when you get hands-on experience. That's the best part. And everyone has been so cooperative so far, whether it were the patients or the facility people. It's not like if you haven't learned much in your college, you'll be freaked out, oh, what will I do in my placements? There's nothing to stress about. All the nurses and everyone around us, they are so helpful. They'll guide you throughout. They will understand that you are learning. They'll not put any pressure on you. So it was good experience. It was full of ups and downs.
More of a learning.
But I enjoyed it throughout, and it's good that I chose EN. So I have some hands-on experience now in hospital before I study for RN, and I have a lot of knowledge about medicines and injections, which I was unsure about in the beginning, that will I be ever able to learn, but makes you confident. So
That's
keep going.
what important is.
Yeah.
Okay. So this was the video. This was all the information which we can get from a person who's doing the same thing which you are looking this video for. That's the main title. So yep. She's Kashish. Sorry, she's Kashish. I'm mentioning her Instagram just coming up here. So if you have any questions, make sure to DM and you can whenever you get time, please.
Hit me up anytime, and I'm happy to provide as much as information I can.
Yeah.
So.
And my Instagram is also in the description. So if you have any questions or anything, keep us posted. Like, share, and subscribe. See you guys in the next one.
See ya.
Bye.